Hey guys, my name is Tim Myers, and this will be my final survival video of the semester for this course. Earlier in the year, we chose a topic for this demonstration, and I chose first aid. So today I will be demonstrating to you skills involved with first aid. And to start off, I wanted to approach it with dealing with someone who is unresponsive or not breathing. And a good principle to know in this situation is called the ABCs, which is airway, breathing, and circulation. First, the airway. If they're not breathing, you want to check the airway for anything that's lodged in there, something that could be blocking the airway. Breathing. If the airway has been cleared and they're still not breathing, you want to start rescue breathing. And I'll show examples of that later on. Circulation. As you do your rescue breathing, you want to perform chest compressions to keep the blood circulating. If the person is breathing but not responding, check their pulse. If the heart has stopped, you want to provide chest compressions. And now I'll bring you to the next part of the video, and I will be showing you some examples of this sort of first aid. For this next part of the video, my daughter Zaylin here is going to be helping me demonstrate how to do CPR. Lay down our victim. Now the first thing we want to do in this scenario is we want to check our scene and make sure that everyone's safe and there's no present dangers. Once we have established that everyone's safe, then we can go and start and check our victim. We want to check for responsiveness or breathing. So the first thing you want to do is see if they're responsive. So you want to try to shake them by the shoulder if you can, and call their name if you don't know their name, or just try to gently wake them up. Zaylin, can you hear me? Hey, are you okay? Zaylin, wake up. Can you hear me? Zaylin. You want to check for breathing as well. So a good way to do this is to put your ear up to their mouth and nose. This way you'll be able to feel the air if they're breathing and listen for it as well. Another good indicator you want to look for is their chest rising with air when they take in a breath. This is a good indicator as well. Once we have established that the person is not breathing, we want to check their airway. Once we have checked the airway and the airway is clear of blockage but they are still not breathing, you want to call 911 immediately. Have someone do this if you can, or have someone get you equipment that you need, because you're going to have to start CPR. And with doing CPR, you want to do 30 chest compressions, hand over hand in the middle of the chest, and two deep breaths in between chest compressions. And you want to do this at a relatively fast pace. And if any of you have ever seen The Office, then you know that a good way to do this is to imagine the beat of the song "Staying Alive" by the Bee Gees. Elbows locked. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We want to rotate this also with doing two breaths into the mouth. To do this, we want to make sure their airway is open. So we want to tilt their head back with their chin, pinch the nose, and breathe into the mouth twice, 1 second each time. If you do have a medical rescue mask available, it's okay to use that as well. This can help prevent the spread of illnesses and germs and other diseases like that. So after the 30 chest compressions, 2 breaths into the mouth, tilting the head back, holding the nose shut. We're going to alternate between that and the 30 chest compressions, going along to the beat of "Staying Alive" by the Bee Gees. And we will alternate between those until rescue has arrived. Next, my daughter Talia here is going to be helping me demonstrate how to do the Heimlich maneuver. And this is a technique that will help save someone that is choking. So the first thing we want to do is identify the signs of someone that is choking. Usually a person's first reaction when they feel like they're choking is to put their hands around their throat. Other signs you want to look for is discoloration in the face, in the lips, fingernails, things like that. You'll see someone turn red and purple and blue. All right, once we've identified that a person is in fact choking, we want to act quick. We want to get on their side, sort of towards the back. Put your arm in front of their chest for support. You want to lean them over so that their face is facing the floor. And these are called back blows. And we want to give 5 back blows right into the middle of the shoulder blades, all right, with the palm of our right hand. And we're going to go like this. 2, 3, 4, 5. Obviously, in a real situation, you want to go a little bit harder than that to dislodge whichever's in the throat. But for this instance, I'm holding back a little bit. We're going to alternate between that and the Heimlich maneuver. So for the Heimlich maneuver, you're going to come behind our victim here. We want to do the same thing. They're going to be bent over a little bit. You want to take your fist, ball it up right there into the abdomen. Take the other one, cover your fist, and we want to do almost a pulling up motion into the abdomen. Bend over. 1, 2, 3, 4, 5. You want to do this 5 times, and you want to do a pulling up motion. You're going to alternate between this and the 5 back blows. Alternate this until help arrives from medical EMTs. So I wanted to speak about for giving CPR to an infant. Generally the same rules apply for doing it for an adult or a child. Obviously the main difference here is the size of an infant and how fragile they are. So with an infant, the same concept applies, but instead of using your hands and your palms, you're going to be using your 2 thumbs for chest compressions. And this can be done by straddling around the baby's torso, putting your thumbs parallel right there at the same chest plate, and doing the same amount of chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And the same thing applies to, you want to alternate between that and opening the airway, tilting the head back, holding the nose, and 2 breaths into the mouth. And that is the conclusion of my video on first aid demonstration. I hope you were able to take away some things from this that will help you in the future if you ever come into a situation where you're having to give CPR or administer the Heimlich maneuver. Hopefully you won't have to, but if you were able to watch this and learn something from it, then you should be in a good position to help someone in the future. All right, thanks.